air.
Hunting, especially when it comes to deer hunting, tends to be an aging population really across North America. That's why health and wellness needs to take precedent when it comes to the sport. In this month's Your Health Matters, we're focusing on what you need to keep in mind if you decide to head out to the woods this hunting season. Rick Bechtold started hunting with his dad back in the 1950s.
As I've gotten a little older, I've had to change some of the things that I do.
Bechtold is a hunter safety coordinator for Leelanau, Grand Traverse, and Benzie counties. His passion is helping people stay safe and well-equipped while out in the woods. He knows firsthand how the elements can play a role in someone's overall well-being.
Be sure of the weather, be sure of your equipment. Layering is the way to go, because if it's a warm afternoon, you might go out into the field and then the weather conditions change and you've got to go all the way back to your vehicle. Hunt with a partner. Find somebody to go with you and just be each other's buddy.
He says no matter the hunting season, you need to always plan in advance. This includes having the proper food and first aid equipment.
Be thinking about your hunt and be mentally prepared.
Our deer hunting population tends to be an aging population. The average big game hunter in North America is somewhere around 50. So it puts us as hunters, the largest percentage of hunters out there that are going to be between the ages of 45 and say 55 are those patients who are at most risk to have their first cardiac event as well. When you're out there hunting?
Dr. Kevin Clayton is a cardiologist with Munson Healthcare who's also an avid hunter. He says women and men need to pay attention to any symptoms they might be experiencing if they plan to go hunting and consider undergoing a stress test beforehand.
If you are a man or woman, 40s to 50s with a family history of heart disease or risk factors like diabetes or smoking or high blood pressure, then you should first be checking with your primary care provider and discussing any symptoms you're having that occur with exertion.
Dr. Clayton says people with any type of heart disease need to be aware of the stress hunting can put on their bodies.
If I have a patient who has coronary artery disease, maybe bypass or history of a heart attack or history of chest discomfort related to coronary disease, what I tell those patients is number one is I don't want them hunting if they're having active episodes of chest discomfort. And I ask my patients who have coronary disease, I instruct them they do not drag deer, ever. If they get a deer down, they have someone come help and drag the deer. Because dragging the deer out of the woods, we've done studies, and what these studies show is, unbeknown to the patient, they achieve heart rates that are dangerously high, and this is where we lose patients.
Beyond the health aspect, Sergeant Michael Beaumay with the Department of Natural Resources says firearm safety also needs to be a major focus.
A lot of hunters hunting from an elevated platform will have a rope or some kind of strap device attach their firearm to that, climb up into the stand first, and then pull their firearm up to them. Hunters have been injured, hunters have been killed in the past by having a loaded firearm, pulling a loaded firearm up towards them.
You are wearing a harness if you're on an elevated platform, whether that's in a tree or a tree stand. There are harnesses you should wear.
And Dr. Clayton also says that he advises his hunting patients to take nitroglycerin with them to prevent the onset of a heart attack. He says it helps to relax the arteries and then reestablish blood flow to the heart if a patient starts to have any chest pain. For more information on the hunting health tips, I've posted this entire report on our website, upnorthlive.com.